and thank you so much for tuning in to Carly BTV. I'm Dr. Karlisha Booze. It's Wellness Wednesday, and we are focusing on your health. Today we have Kari Willingham. She is the Director of Women's Services at Piedmont Macon. Good morning, and thank you so much for coming on the show.
Good morning. Thank you for having me.
All right. So Piedmont Macon, you have a new obstetrics emergency department coming in, coming up. Can you please just talk to me about, what exactly is the obstetrics emergency department?
Sure. So we've always been able to see pregnant patients that walk through the door at any time. We're open 24 hours a day, 7 days a week to provide that care. The difference that we have now is before we would just triage patients with a nurse and they would call the primary care provider and kind of give report over the phone. You may or may not be seen by a doctor, but now with our new OB obstetric emergency department, we have a physician, a board certified obstetrician that's here 24 hours a day, 7 days a week to provide that immediate expert care for the pregnant woman.
Nice. So which type of patient would this be catered towards?
So we here on labor and delivery will see the patient that is 20 weeks or greater in their pregnancy. The OB hospitalist that will be here will also tend to the pregnant patients that are in less of a gestation, but it will be in the emergency department, not on the labor and delivery unit.
Okay. So what makes this experience a little different than, the typical OB assessment?
So again, OB assessment is just completed by a nurse. So we do have very skilled, very tenured nurses here that have great assessment skills. But again, the physician's not the one laying the eyes on the patient. They're just going off of a phone call that a nurse has said, this is what I see. So now with the OB hospitalist being here, immediately once the nurse gets the patient put onto the monitor, make sure the baby's okay, a doctor will actually come to the bedside and do a full assessment as well. And then if that doctor thinks that you need to be admitted because you're in labor, then that physician gives report to their primary care provider if they have one, and that doctor will come in and do the delivery. So sometimes there's a little anxiety about, well, that's not my doctor. But if you're saying, we will definitely make sure that your provider is here to be with you throughout your delivery process.
Nice, nice. Now, Carrie, the month of April is observed for Cesarean Awareness Month annually, and it's just a chance where medical professionals can pretty much promote just the facts of healthy options. Just having a mother coming in, and she's possibly in labor, like you said before. What can you do, or what can this new initiative, how can it reassure her that she's good to go? I mean, there's a doctor there already,
Absolutely.
how will this affect her?
So this will affect her because if we get into a situation where a baby is in distress and your doctor may not be in the hospital because it's during the daytime and they might be seeing patients still, we're able to move much quicker in an emergency situation. So we can go and do a C-section immediately if we need to. But there's also other things, the interventions that we can do. We can turn a patient, and the nurses really get into helping decrease that C-section rate. Sometimes it's a game that we play, let's turn our patients. We've got peanut balls, different positionings. We like to follow pages on Facebook that's spinning babies. So how can we get that mom to have a successful vaginal delivery? Because we know if we have C-sections, typically subsequent deliveries are by C-section, and then there's greater risk with infection and post-op wounds and just a slower recovery time if you have a C-section versus a vaginal delivery. So we love the challenge. We take great pride in when we have that vaginal delivery. We celebrate every one of them that we have, just trying to make sure that we have the safest delivery for mom and baby, of course.
Okay. Now, what are other services that Women's Health offer here at Piedmont Macon?
Sure. So we offer couplet care for our postpartum moms. So babies stay with the moms in their room all the time. We also have a level 3 NICU here. It's only 13 beds, but what I like about it is it's more of a homey feel. So we can take those micro preemies, those 23, 24-week deliveries. We are fully capable of taking care of those little bitty babies and their most vulnerable time as well.
Okay. So how can our viewers get more information about these services?
So they are more than welcome to come and do a tour of our facility. We have we offer those at any time. They can just drop in. Then we also offer some free community classes once a month for child birth classes. We also have a baby basics class, and we do tours with those as well. So
Okay. Well, thank you so much, Kari, for coming on the show. I'm really excited about this new emergency department, and I know it's going to add more value to Piedmont Macon than it already has. Thank you.
thank you.
What's happening weekend on KBTV? And this your boy Country Wayne.
Hey everybody, this is Tamala Man, and I'm rolling with Carly BTV.
Hey everybody, my girl Tamar Braxton, all the way live on Cardi B TV.
Yours truly, Atlanta's own MC Lifey, and I want to let you know I'm all the way live with Carly B TV. That way, the long way. I'm always Carly B TV. Peace up and A-Town down.
Yo, this is Henry Wells, the most feared man in comedy. Street T, all the way live on Carly B TV. I'm here, baby. Check them out.
Hey, yo, what's up? I'm Tony Terry, all the way live on Kari BTV. You heard me?
Poker Bear, all the way live with Kari BTV. You understand me? You gonna learn today, babe.